All right, good afternoon, everyone. My name is Salma Hassan. I'm the Trading Associate here at CADCA. Thank you for joining us today for our NCA Supplemental Webinar Series. This is the second one of the year. Today's webinar is going to be hosted by our lovely Master Trainer and CEO of her Coalition Prevention Alliance of Tennessee, Stephanie Strutner, on the topic of community readiness and coalition effectiveness. Today, we will explore the dynamics and importance of community readiness in initiating and achieving community level change. So yes, thank you for joining us. I'm going to pass it off to Stephanie now and give her all the attention.
Thank you, Selma, and good afternoon, everybody. Glad to be with you. And I want to start today off by just being really transparent and saying that community readiness isn't something that we just inherently know that we need to measure and that we need to follow. And when I started with my previous coalition in Anderson County, Tennessee, our coalition did just what you're doing. We went through the National Coalition Academy. We created a community assessment. We looked at the data, we assessed it, we made data-driven decisions. We knew that by and large, underage drinking was the biggest problem facing the students in our community. And so we set out to address underage drinking. However, the community wasn't ready to address underage drinking. There were several reasons why. One is they were constantly inundated by the media about methamphetamine. At that time, methamphetamine use in Anderson County, Tennessee was relatively high. Among our adolescents, 34% of our adolescents engaged in past 30-day alcohol use. However, less than 0.5% used methamphetamine. And so we were letting the data do the talking, but what was happening is people were hearing all the time in the media that methamphetamine this and methamphetamine so prevalent. And in fact, the clandestine methamphetamine lab seizures in our county were the highest in the state, and our state was the highest in the country at that time. And so people were justifiably thinking about methamphetamine. So we had to engage in a community readiness process and address methamphetamine and the changes that had happened, but also focus attention on underage drinking so that people could move to a place where they had no awareness, at least to a position of denial or resistance, so that we could get on the continuum to be thinking about the issue of underage drinking and leading to community ownership. And so as we engage today in this conversation, I want this to be a safe space for you. I want you to be able to share in the chat box some of your experience that you've had with respect to community readiness. Even if you've had some missteps along the way, we're all here to learn together and to be able to engage in this training. And so please, if you have questions, you may either raise your hand. You can also type them in the Q&A box. So if you have a question for me, please post that in the Q&A box. If you have a question for any of the other participants on the call, please feel free to put that in the chat box. Being a moderator, sometimes that text does get lost when it's a large group. So if you have a question directly to me, please tap the Q&A button and you can type that question there in the Q&A box, the question and answer box. As we begin today, I want to acknowledge that this is one of the supplemental webinars for the National Coalition Academy, and today we are talking about community readiness. We're going to, as we work through our time together today, be looking at different scenarios. We're also going to think about the components of community readiness and think about how we implement those in our communities. We also want to recognize the different dimensions of community readiness, and actually there's a great model out there that we can utilize. None of us ever have to reinvent the wheel. We also want to talk about how to conduct a community readiness assessment. It's one thing to talk about community readiness, it's another thing to actually go and do it and apply what you learn to your coalition's work. As we move through that conversation, we then want to be able to identify strategies on how we move our community from one level of readiness to the next. So in order to really have a robust conversation about community readiness, we've got to think about a community. So what is a community? Most of you are going through the National Coalition Academy, so you already know that communities are traditionally defined as the people in a geographic location, but we know that it can be more broad. And in some instances, we talk about a group of people who share something in common. And so we might be members of a faith community, or we might have a sports interest or an interest in puzzles or the arts or whatever your interest may be. There may be communities based on our ethnicity or our culture, our business, our social experiences, even our age or our geographic location. And so community can mean more than just that geographic location. The community readiness model identifies 9 stages of readiness, and we'll talk about each of those in depth today, but it's based on measures among both community members and the leadership in our community. And we assess readiness based on 5 key dimensions. This is an important component of community readiness because we aren't just focused on one subgroup of people. Rather, because our coalitions are engaged in population level change, we want to measure readiness among our entire population. When we assess community readiness, it helps the coalition by giving us ideas that will help diagnose where we need to put our initial efforts. A lot of times in the National Coalition Academy, coalitions ask, where do we even begin? Once you have an idea of the problems, root causes, and local conditions in your community, a community readiness assessment is a great place to start because it helps us to identify the weaknesses, the strengths that we have in our community, and the obstacles that we may face as a coalition as we're implementing the strategies that we have planned. It also helps us to point to appropriate actions that match our community's level of readiness so that we can work within the culture where we live, work, and play to come up with actions that are right for the people that we're serving in our target population. It also helps us to secure funding and cooperate with other organizations, work with our leadership, and be more dynamic in our communities. So the key components to this community readiness model that we're going to talk about today are: 1, a survey of questions, also key informant interviews. There's a scoring rubric that goes along with it, and that gives us a readiness score. Once we have a readiness score, we're able to identify where our community falls on the readiness model, and then we can plan for action based on those results. So ultimately, we're using data to make a data-driven decision toward what's going to be effective, the most effective utilization of both our time and our resources from the coalition's perspective. So when you are measuring information to lead toward a community readiness assessment, you're measuring attitudes, you're measuring knowledge, you're measuring understanding of efforts and activities that are going on in the community, and you're looking into resources that already exist, both among community members and the leadership in your community. There are 6 key dimensions of community readiness. The first is community efforts, also community knowledge of those efforts, leadership, community climate, community knowledge about the issue, and then resources related to that issue. So when you think about community efforts, we're really just asking the question, to what extent are there existing efforts or programs or policies that address this issue in our community? When we move on to our next dimension, we want to know more about community knowledge of those efforts. So not only what are the efforts that are ongoing, but then how much does the community know about those efforts? So what extent do community members know? And also, are the efforts accessible to all segments of the community? So we have this cultural capacity and cultural awareness piece come in to make sure that all segments of the community are able to access these efforts. If you think back to the mapping exercise that maybe your coalition has done before, and you identify different needs and resources in the community as it's laid out on a map, this gives us a great visual as a coalition to identify if there are barriers, whether they be geographical or socioeconomic or otherwise, that prevent people from accessing the resources that exist in a community. Leadership is the third dimension of community readiness. And when you think about community leadership, the question that you're asking is, to what extent are our leaders and influential community members supportive of this issue? And so a lot of times our work starts from a grassroots level and works its way up. However, it can also be really effective in communities when ideas start at the higher level or at the policy level with those elected or appointed officials, and then trickle their way down. And we can be most effective in our communities when we use both approaches, both the grassroots effort where we start from the bottom and work our way up, and the grass tops effort where we start from the top and work our way down so that we can meet in the middle. Another dimension of community readiness that we want to look into is community climate. So, what's the prevailing attitude in the community toward the issue? The political climate may tie into this as well. Is the community feeling helpless about the issue, or are they feeling some form of responsibility, maybe even empowerment about the issue? We want to identify the community's climate around this issue, recognizing that it can be issue specific. We also want to know what the community knows about the issue. Do they understand the causes of the problem, the consequences, or how the problem impacts the community at large? If not, it's a great opportunity for the coalition to intervene at this juncture. Resources related to the issue is another dimension of community readiness. And when we observe and investigate resources, we want to know to what extent are the resources in our community, whether it be the people, time, money, space for us to do our work, available to support our efforts. How willing are people in the community to help offer these resources related to the issue that we're working on? So I'm going to ask you to pause for a second and be self-reflective. How many of you have ever tried to change your own behavior? And there's nobody who can see you, and so you're in a safe space, but you can answer just there among yourself. I see a few of you raising your hands, so I can raise my hand too. I myself have tried to change my behavior. So, how'd that go for you? Were you successful in changing your behavior? Maybe you had some missteps along the way. Maybe you started and you stopped. When we're ready to change our behavior, we go through a stage of change. This is for personal readiness for change. And so many of you may already be aware through studying social sciences of the personal readiness for change, or the stages of change model. In this model, the first stage is pre-contemplation. And in the pre-contemplation stage, we're not yet acknowledging that there's a problem behavior that needs to be changed. It's the contemplation stage, that second level, where we acknowledge there's a problem, but we're not yet ready or sure that we want to make a change. During the preparation stage, we're getting ready to change. I've got to do something about this, so what am I going to do? Action is when we take action to change our behavior by using a variety of techniques. Maintenance is when we continue that commitment and we sustain that new behavior, but then there can be a relapse place where we return back to those older behaviors. We toss those new changes out the window and we're back to that pre-contemplation stage. So if we think about these stages of personal change, I mean, I can tell you there have been a number of things in my life that I have tried to change, and there have been times where I've been extremely successful, and there have been times where I wasn't successful at all. In fact, one time I took a class, it was called the Consortium for Social Enterprise Effectiveness, and it's at the local university. Think an MBA for executive directors of nonprofits. And in part of that class, during the leadership component, we had to do a 360-degree analysis. So where we evaluated ourselves, our peers evaluated us, our superiors, subordinates, even family members and friends evaluated us on a number of different scales. And then we got to look at places where we should improve ourselves. Well, one of the places that I needed to improve is I can really get tunnel vision, and I can sit down, and if I'm in the middle of a project, then I am totally committed to that project. And it's very difficult for me to transition to give enough attention to someone, for example, if they come into my office and want to speak with me. And also, I will totally avoid self-care. If I'm in the middle of something, I won't get up to go to the restroom. I won't get up I won't step away from my computer for any reason. And so there are a number of reasons that this is not healthy behavior. And so part of my 360 analysis in my professional and personal development plan was changing my behavior and how I operated at the office. So I would just come in the morning, I would sit down at my computer, and I wouldn't leave the computer until it was time to leave at the end of the day. And usually I was trying to cram in as much work as I could before I left. And so I had all these strategies and incentives and all these things that I was going to do to change my behavior. This was back in the early days of the Fitbit, the first time that you had a little reminder on your wrist that would buzz and say it's time to move. And so I even bought myself one of those. And the first few weeks, it would buzz and it'd say it's time to move. And I'd get up and I moved my printer to the other side of the room. So I at least had to get up and walk across the room to go access the printer. And I had set up some systems to where I was engaging in some self-care, to where I would get up and walk away from my computer. And I said that every 2 hours, I was going to take a 5-minute walk around the block. And, I did pretty well for a few weeks, but then after that, I reverted back to those old habits. And so we have this personal readiness for change model, but it takes a lot of different strategies to be able to initiate that change, even just within myself, where I had identified that I wanted to change. It's really not that different when we think about community readiness to change. So how do we know when our community is ready to change? It's difficult enough for me to initiate a change within myself, but here we are working in these population systems. We're working with so many different people and encouraging the entire population that's engaged in risk behaviors to change their behavior. And so how do we do that? Well, the first thing is we need to know where people are. Oftentimes in coalition work, we talk about how we need to meet people where they are. Well, how can you meet somebody where they are if you don't know where they are? Measuring community readiness gives you the opportunity to measure where people are so that you can meet them there. And so we are finding ourselves in this continuum, if you will, and there's a lot of information from the Tri-Ethnic Survey on Community Readiness. It's a product of Colorado State University, and it gives us a great tool so that we can see how we step through the readiness model. So we might begin at this place of no awareness, but we could move to the next place of denial or resistance, then on to vague awareness. From vague awareness, we may go to pre-planning. From pre-planning, we may move to a place of preparation, and then initiation, stabilization, expansion, and confirmation, and community ownership. What's important, and I know that you find yourselves in coalition work because you're a super eager person, you're a doer, you want to get things done in your community, and you're really good at it. And so I know that there are a whole lot of you out there who are looking at this and they're like, well, my community may be in denial and resistance, but we're going to go do this and they're going to be in community ownership. Well, I'd like to invite you to take a deep breath, because that's not how community readiness and readiness for change works. We just want to set as our goal to move from one stage of readiness to the next. And then when we get to that next stage of readiness, we're going to have a series of strategies that are going to help us to move to the next stage of readiness. And so we don't just snap our fingers and move to community ownership. Rather, it's a process that we follow methodically from wherever people are in our community through the rest of the process. To begin conducting a community readiness assessment, the first thing that you have to do is identify and clearly define your issue. It doesn't do us any good to go out and measure something that's arbitrary with respect to community readiness. Because community readiness is issue specific, it can even be as specific as local conditions. We have to be able to identify and clearly define what it is we're trying to achieve and what we're trying to measure. Then we want to clearly define and delineate our community. As we do so, we want to be able to prepare our interview questions, choose the key respondents that we're going to measure, conduct and transcribe interviews, and then somebody will score those interviews, and then we'll calculate the average dimension scores. Once we do this, it gives us the opportunity to identify and be able to strategize where we're going to go next. As I mentioned, community readiness is issue specific. So a community can be more ready to address change on one issue while being at the very earliest stages of readiness with respect to another issue. And it's measurable. It's measurable across different dimensions. Not only can you get assessments of community readiness, you can also accurately measure where the community is on the different elements of readiness. So think about, let's take cannabis use, for example. If we had a root cause of ease of social availability of cannabis, and a local condition was, let's say, adults share cannabis with each other on the weekends after dinner parties. Maybe another local condition is youth take cannabis from adults who are using it at dinner parties. There may be a huge chunk of the community that is absolutely ready to address the youth cannabis use local condition. But there are also, even those same people who may be ready to address youth cannabis use may not be ready to address adult cannabis use. And so that's why community readiness is as specific as our local conditions. And as we're measuring, we need to be mindful of this idea, because we don't want to just go measure substances. We want to be able to measure readiness as it relates to those local conditions and even the root causes that your coalitions are working on. We also want to take note that community readiness can vary across dimensions. So a community may be more ready to address an issue in some ways than in others. We want to make sure that we know everything that we can know about an issue and realize that it's a problem, so that we can conceive of implementing a particular solution. Being able to measure the community's readiness is important here because it helps us to identify and differentiate where our community may be ready to address some issues rather than others. This is really important in our prioritization process as coalitions. A lot of times coalitions say, okay, we've got these problems we've identified, we have root causes and local conditions, but which local conditions should we start on? Well, community readiness can help us identify where we start, because what happens as we implement those strategies to affect change within that local condition, remember what happens in a logic model. We have that line logic that falls back. So when we change that local condition, we change that root cause a little bit. And then we have another local condition. And when we start those strategies, we go back and we change that root cause even more. And as we change that root cause, we're going back and having an effect on that problem. And so as we do these strategies, as we implement the work of the coalition, it gives coalitions the opportunity to also affect change within community readiness. And as we affect change within community readiness, we're changing norms, we're changing attitudes, and that's changing many root causes that coalitions are identifying. And so as we do this, it innately gives coalitions the ability to engage in community readiness and moving people across that model of change to a place where we can begin addressing some of those issues that when we very first started, the community wasn't able to address. We also want to take note that community readiness can vary across different segments of our community. So some groups, like members of your coalition, for example, may be far more ready to address some of your local conditions than other people in the community. However, there may be other segments of the population who are in a place of denial or not even acknowledging that there's a problem. And so recognize that different segments of the community may see your problem issue differently. And as such, it's important that you have a diverse cross-section of your interviews and the people from whom you're collecting data. We don't want to just collect community readiness assessment information from our coalition members, because our coalition members already have a valued interest in the work that you're doing. We want to assess readiness based on the entire population of the community. And so in order to do that, we've got to find people who meet the different demographics that are representative of the communities that we serve. We also want to understand that community readiness is essential to build our knowledge for addressing a particular issue. We could, if we went out into our community and we engaged in something that they weren't ready for, our coalition could quickly lose credibility, and we could also damage some relationships. And we know that building capacity is so critical to our coalition's ability to be sustainable, to be effective, to achieve those outcomes that we've set forth. And so when you are engaging in strategies in your community, you want to make sure that you recognize the community's level of readiness so that you can tie in the appropriate strategies so that you can make sure to continue building trust among members of your community, and making sure that you're moving the coalition in the right direction so that you can be successful, so that you can be sustainable. I want to slow down for just a moment because I want to give you the opportunity to think about community readiness as it relates to your community. So, what I'd like for you to do is just identify an issue that your organization works on. You can think about your logic model. What is one of the problems that your organization works on? So, for if you're a coalition, it may be cannabis, it might be prescription opioids, maybe it's underage drinking. Identify an issue that your organization works on, and I'll give you a few minutes to think about this. This will just be a practice exercise, so you don't have to put a whole lot of thought into the substance that you identify. The process would be very similar for other substances as well. Okay, hopefully you have identified an issue that your organization works on. And I want you to think about that issue in respect to community efforts. So, to what extent are there existing efforts or programs or policies that address that issue that you selected that your organization works on? And go ahead and write down some of those existing efforts in your community around that issue. Not only those that the coalition are doing, but especially those outside of the coalition. And this would be a great time to engage in the chat box and use the chat box to share some of your ideas, because we learn so much by sharing with others. So please do um, share some of your ideas in the chat box. Thank you, Brian and Susan and Colbert, for your engagement in the chat box. Thinking about those community efforts, I'm seeing that tying policies to religious institutions, hosting community listening sessions, um, beginning stages of an environmental scan, compliance checks through law enforcement, and ID checking guidebooks with alcohol retailers, partnering with those businesses. Local ordinances, including diversion programs and compliance checks. Great ideas. In another dimension of community readiness, we want to be able to recognize community knowledge of the efforts in the community. And so thinking about that same issue with respect of your coalition, to what extent do people in the community know about those local efforts and their effectiveness? And then as a follow-up, thinking about community knowledge of the efforts, are the efforts in the community accessible to all segments of the community? And I think this is an area where I'm continuously learning. There are things just literally in the last week that I've picked up on with respect to creating PowerPoints that are accessible. And so, before I would have said, oh, yeah, everything that I put out there is available to all segments of the community. But then, when I really sit down and think of it, there are definitely items that I can improve upon. And so I think that we have to acknowledge our implicit bias when we're thinking about community and community knowledge so that we can really get out there and have a true assessment. I want to draw attention to an important point that Colbert made in the chat box, saying that our youth are really asking questions around racial justice and substance misuse. And I believe, I see as we go further and further through the years in our movement in prevention, that we're really seeing ourselves positioned as this community convener. The coalition is trying to reduce stigma around substance use disorder so that we can have conversations, and then that in itself is a protective measure so that we can engage in prevention. And so what I'm seeing is really a lot of coalitions being able to tie in not only racial justice, but other social justice issues, and really be able to tie them into our work, because we know and we recognize the risk factors that exist in the community. And when we do, when we can identify those, we can also identify those countermeasures, those protective mechanisms that we can build into the community. And in order for our efforts to be accessible to all segments of the community, I think we really do have to recognize the different demographics in our community and have that element of cultural competence so that we can make sure that everyone is reaching their full potential. And Susan, also appreciate your comment about besides social justice, youth mental health being a very important issue as well. And I believe I've seen, as a result of the pandemic and the physical distancing that people have been required to engage in, has really affected mental health. I think from my perspective, the silver lining of the terrible situation that everyone has endured through the pandemic, the silver lining might be that conversations about mental health and mental wellness seem to be a little bit more acceptable. People are more open to having those conversations, and especially youth. When I've done some surveys among youth, what I have found is youth feel more empowered to talk about their mental health. And so I do believe that that mental health component is the tie to social justice. So not necessarily an aside to social justice, but they tie together very importantly when we think about community readiness. So after you identify community knowledge of your efforts, we then want to think about the leadership in the community. So to what extent are appointed or elected leaders in your community supportive of that issue? And so this is where we kind of try to meet in the middle from that grassroots up and the grass tops down approach. So just sketch some notes about leadership in your community. Do the elected or appointed leaders in your community know about the issue that you're working on? And if they know about the issue, are they supportive of your movement? Yeah, again, Susan, thanks for your conversation in the chat box. Very supportive by some, and others have their head in the sand. And I think that this is common. We see this in communities all the time. And so our challenge as coalitions is to be able to go and meet with the people who have their head in the sand so that we can help to bring them up with the rest of the herd and then be able to move this movement forward, move our entire community forward collectively as a group. So it's also great to see some of you who have very supportive elected officials in your community. Nice work. We also want to look at the dimension of community climate. And so what's the prevailing attitude of the community toward the issue? This may tie into politics. It may also tie into financial or fiscal responsibility. We want to think about the community climate, and do people feel helpless about the issue, or do they feel empowered that they have the ability to do something about it? So what's the community's climate with respect to the issue that your organization works on? And then we want to think about the extent to which community members know about the causes of the problem. Do they recognize the root causes? Do they recognize the consequences and how this issue impacts your community? So I encourage you to take a couple notes about that community knowledge as well. Once we think about those, what the community thinks, we then can identify some resources related to the issue. What local resources are available? Do we have the people? Is there money in the community dedicated toward alleviating these problems or issues? Do we have the space to be able to do what we need to do? What other support efforts are there in your community related to this issue? So right now we're not really thinking about coalition related resources, but what other resources are available in the community? One, that the coalition could tap into, but two, that helps us to kind of spread this idea across the community. It's that ripple effect. Mother Teresa once said, "I alone cannot change the world, but I can cast a stone upon the water to create many ripples." And I always think about that when I think about coalition work, because so many of us try to do all the work on our own. But if we can be the ones to cast that stone and we can spread that movement, then what it does is give other people the opportunity to cast a stone as well. And so that's where we think about tapping into those other resources that are available in the community. So when is our community ready to change? And this is what we really want to consider. And so we have the community readiness model that identifies the stages of change. And when we think about the stages of community readiness, it gives us the opportunity to identify where our community is with respect to readiness and how we can move up to the next step. So I'd like for you to think, so look back at your notes that you've just taken about the issue that your coalition is working on and try to identify, obviously you don't have the data in front of you, but if you had to guess, where would you identify where your community is with respect to the issue that you address? And I'd invite you to type that in the chat box. Good. Looks like many of you have a pretty good knowledge base of where your community might be, and vague awareness seems to be the overwhelming favorite response. Although I appreciate, Charity, your response, that you're kind of in that vague awareness with a healthy dose of denial. I appreciate your transparency there. And then some of you look to be in pre-planning, a couple in preparation. So thanks for considering this. It's important to be able to consider and really assess where your community is, because what this does is prepare us to move forward, to be able to strategize, how do we move people from this one stage of readiness onto the next. Mentioned before, our goal isn't to take our community from vague awareness to confirmation in one step. We want to go from vague awareness into pre-planning. And then once we get ourselves and our community in pre-planning, then we want to initiate strategies to get us to preparation. And so coalitions work really hard in identifying the 7 strategies for community level change tied to our local conditions. But coalitions take it next level when we not only identify those strategies for community level change, those 7 strategies, but we also take the community readiness model into consideration, and we build in those strategies of moving from vague awareness to pre-planning. And then once we get from pre-planning, we plan again, and then think, how can we get from pre-planning to preparation? And then once we get to preparation, we go back and we plan again. Remember, your National Coalition Academy instructor has probably talked to you about the strategic prevention framework being like a spirograph. And so if you've heard them say this, you know that we cycle through and through and through and through each of these components of the strategic prevention framework. And so we're constantly going back to this planning phase when we move from vague awareness to pre-planning. And then we go back to the planning board. We engage in some new strategies. We identify what they are to move our coalition and our community on then to preparation. And so you can see how this begins to just kind of move one step at a time, one rung at a time. Once we think about and assess where our community is with respect to readiness for change, we can then identify the best fit for the strategy that matches where people are. When we think about identifying the best fit, we want to first find the options that are out there, consider the fit, consider the strength of evidence. So how does the evidence support what we think we want to do? And then we can match those things together to lead us to the best fit for our community. And then we can identify and justify that with having a strong level of effectiveness, and having evidence that other people have done something similar can also help you identify what you want to do in your community. When you consider fit, the evidence of effectiveness, we're really just talking about the proof that a program or practice can, or in some cases cannot, do the job that we need it to do. So for an example, watching someone use a handsaw to cut through wood is evidence that that specific saw is effective at completing that task. We also may have conceptual fit. And so conceptual fit is something that we would use often in our field, especially when it comes to transferring information and activities from one substance to another. So conceptual fit is the degree to which a program or practice is a good match for the job that needs to be done. It directly addresses the priority substance use related problem, along with at least one or more risk or protective factors. It has been shown to produce positive outcomes among the community's focus population in a different area. And so an example of conceptual fit here is a saw is a good match for the job of cutting a piece of wood, and it works better than a hammer would or a screwdriver would. Practical fit helps us to understand the degree to which a program or practice is a good match for the people involved in our community and our community overall. And so the practical fit would be something that our community supports, that's feasible for our coalition to implement. It may also complement other things that we're doing. So, for example, a handsaw may be a good match for someone who wants to cut wood, but who cannot afford or comfortably operate a power saw. So we want to make sure that if our community is not comfortable operating a power saw, that we go straight to the handsaw. We don't want to throw out prevention programs, prevention infrastructure in our community that are like power saws when our community is only ready to use a handsaw. We want to teach them how to use the handsaw, get them comfortable with the handsaw, and then slowly implement the idea of the power saw. To be successful in making change, when you identify that your community is in no awareness, our goal here is to raise awareness that the issue exists, plain and simple. We can do that by making one-on-one contacts with our community leaders or other community members. We can visit existing and established groups in the community to inform them of the issue. A lot of times coalitions will work with civic organizations like the Rotary Club, the Lions Club, the Civitan clubs, meet people where they are and talk about the issues that your coalition is facing and working to address. Make those one-on-one phone calls to potential supporters in the community. Put items in the media that help to bring attention to the issue. We want to do everything we can to raise awareness about this issue. Sometimes what this means is sharing data, but using data in the right way that translates to help people understand that issue. When you identify that your community is in denial or resistance, you've got to raise awareness of the problem on this issue in the community. We can do so by continuing all of the things that we were doing in the previous effort, but we also want to discuss the descriptive local incidents related to the issue. So if there have been negative things or there have been evidence that there are consequences associated with these problem behaviors, we want to talk about those. Sometimes it can be really uncomfortable. Approach and engage our local education programs or maybe health outreach workers to assist in our efforts of distributing information across the community. Begin to point out media articles that help to describe those local critical incidents where we're able to document those consequences. Or maybe place your own items in the media, a press release or a letter to the editor. Prepare articles for church bulletins, for newsletters, for club notifications, for magazines. How do people get information? How do people digest news in your community? Meet them at their preferred outlet. Present information to local related community groups. And then you will move your community to vague awareness. And when you do, people are now recognizing that there's a problem that they need to be aware of. And not only there's a problem, but there's something that they can do about it. So get on agendas, present information to the community. Even if they're unrelated community groups, get some FaceTime with them, whether it be the coalition director or a coalition member or other volunteer. You can post flyers or posters or billboards or even initiate your own events. And then also conducting, they can be formal or even informal surveys with people to begin identifying how people are getting information, what they're thinking, how they're recognizing the problem. And then of course we can utilize the media as well to get that information out. From there, your coalition or your community will move to a level of pre-planning. Many of you said that this was the place in which you identified your community. And so at this level, people are ready to start thinking not only, okay, we've got a problem, but how do we address this issue? They're feeling a little bit empowered to do something about it. And so at this juncture, coalitions can introduce information about the issue through presentations, through the media, to visit and invest community leaders in the cause. So we want to make sure that we're showing up to those community events, we're showing up to community meetings, and we're constantly talking about the issue and how we can mitigate the risk or even prevent it. Review existing efforts in the community. So what are other people doing? How can we collaborate together? How do we determine who the target populations are? And how can we consider the degree of fit so that we can identify the success of our efforts? Conduct those local focus groups so that you can identify the right strategies to match with community readiness and your local conditions. Continue to increase that media exposure so that we can reach people where they are. So media might mean television, might mean radio, it might mean over-the-top streaming services and commercials related. It might mean ads on TikTok or Facebook or other packaged videos or social media messages. Depending on who our target population is, we want to meet them where they are. And so we might have to do a little back end work in our community to make sure that that happens. Until we get to a place of preparation. And then here the goal is information gathering so that we can lay the groundwork in our community for planning those strategies so that we can head on directly address that issue. So conducting surveys, sponsoring community kickoff events, having public forums, again, talking about that grassroots level and the grass tops level and how can we meet in the middle, utilizing key leaders in the community. I always talk about the Maven. So Malcolm Gladwell is one of my favorite authors, and the first book that I ever read that he wrote is called The Tipping Point. And in The Tipping Point, he talks about the Maven in the community. That translates to present day social media influencer. So these are the people who are leaders in their own right. People follow what they do simply because they do it, not because they go and tell people about it, for no other reason other than they did it and they have a trust factor with people who know them or follow them. And so that we can utilize those key leaders and their behavior speaks for itself. Plan how to evaluate the success of your efforts. We see this evaluation component showing up again and again and how important it is to make sure that we're successful in making change in our community so that we can move to a space of initiation. And when we move to a space of initiation, we now need to be more specific in providing information about existing programs and initiatives so that our community can really be able to publicly support the work that you're doing so that we can have new startup activities so that other people in the community, we have been talking about that grassroots development, that this is where that happens. People begin to attend the things that the coalition is doing. Identify service gaps or improve existing services. Make sure that there are key places in your community so the coalition can be this convener so people know where to go so that they can get information. Begin searches for additional resources. How are you going to continue this movement? How will you fund it? How will you sustain it? And then, of course, evaluate your work so that you can move to a place of stabilization. And in the place of stabilization, your efforts and your programs are already in place, but you have to stabilize them so that you can maintain the overall community effort. We, in the field of substance use prevention, talk about the law of diminishing returns sometimes, whereas there is only so much work that we can put in, and then we get to a certain place, and then we have to put in that same amount of effort just to maintain where we are. So think about prevalence of underage drinking. You may have an extremely high level of underage drinking, and you put in all of these inputs and all of these strategies, and your level of underage drinking decreases, let's say significantly, which is fantastic. But if you back off of any of the strategies that you've already done, then what's eventually going to happen is your rates are going to revert back to where they were. So we have to keep our foot on the gas pedal. We've got to keep moving forward and make sure that all of those programs and strategies that we put into place stay there and are stabilized so that our work continues, so that we keep that prevalence of use, for example, low. During stabilization, we always want to make sure that we're continuously modifying what we do based on our evaluation results to make sure that we're achieving our objectives. Making sure that we're recognizing the people who are working toward this initiative, preparing and submitting articles or social media posts or whatever it is that your coalition does to detail your progress so that you can continue to plan for the future And then, continuing to network, this capacity piece. Oftentimes, a lot of the CADCA trainers will joke that the capacity piece of the strategic prevention framework belongs in the middle, because we're constantly circling back to capacity. We've got to keep building that capacity so that we have that network among all the service providers, all the community systems, the elected officials, and all of the people who live in the community, so that we can stabilize these efforts. Once we do, then we want to move to the 8th place of confirmation and expansion. And so once we get to this place, our services are stabilized. We're working on expanding and enhancing them often. And then we have formalized agreements and a great network that helps us to assess the community, to provide the program delivery, to have a comprehensive place where there's information sharing and people know where and how to get it, initiating policy change, having that media outreach, and making sure that we're using those data to drive our decisions so that we're continuing to be very successful in our efforts in the community, until finally we get to this place of a high level of community ownership. This is the highest level of the stages of change model for community readiness. And so the trick here is, once we get to this place, to maintain enough momentum so that we continue our growth. We're not done when we get to a high level of community ownership. Think back to the concept of the law of diminishing returns. We still have to make sure that we're putting in enough inputs so that the members of the community maintain that high level of ownership, so that they keep on doing what they're doing, so that we get the financial support that we need, we get the in-kind support, we get the volunteers, we have the people who help do the work of the coalition. When you find yourself in this place of high level of community ownership, it's important to be able to diversify your funding resources. This again leads to our sustainability, because it gives us the ability to maximize the number of stakeholders that we have involved, so that we can maintain that high level of prevention infrastructure. We can maintain all of those strategies that we have seen have been working. We want to continually reassess our position and any progress that you're making. Utilizing external evaluation is a good idea at this juncture, to make sure that you're tracking your outcome data, that you can use not only to be transparent, to celebrate the success of all of the people who've helped you along the way, but also because that looks really fantastic when you're applying for funding and you have evidence of success that you can show in a tangible way that leads to community impact. So I want to begin wrapping things up, and then I want to give you a space to engage with some questions and maybe even some comments about how you've used community readiness. So, thinking about assessing community readiness, there are a number of benefits that come along with it. The first is really just helping to diagnose where we as a coalition need to put our initial efforts, identifying any weaknesses that we have in the community, strengths that come along with that. Are there any obstacles that we're going to have to face? And if so, how can we meet those obstacles and have an immediate workaround, or anticipate the obstacle so that we're able to easily step over it and get past it? We can also identify those appropriate actions that match our community's level of readiness. And this is the biggest take-home message that I want you to take away is, we want you to identify the strategies and the activities that are going to be best for your community based on their level of readiness. Because we don't want to start in the community where Stephanie Strutner is ready with respect to community readiness. We want to start where the rest of the community is, so that we can all move together, so that we can get the most people at that grassroots level to join us and make the biggest ripples, the most ripples across the community. This gives us the opportunity to come up with the actions that are right for our specific community. We are in a beautiful situation with the Drug-Free Communities Grant, and the Drug-Free Communities Grant gives us the opportunity to identify local problems and local solutions. And so when we do this, it really gives us the opportunity to make things right for our community. In order to make things right for our community, let's assess their level of readiness. And, while it's not required, putting a bit about community readiness in your community assessment is a great idea because it gets it on your radar so that it's something that you're continually assessing. This gives us the ability to do so much more in our communities, to be really strong collaborators, to be able to cooperate with other organizations so that we can really start this movement of substance use prevention in our communities. So let me pause here for a moment because I want to turn to you. I'm going to turn to the question and answer box and then also the chat box if you all have any questions. Any questions, type those in the chat box, or you can use the question and answer option as well. Also like to invite any of you who have engaged in a community readiness assessment to tell us, how did you go about assessing community readiness? And you can do that in the chat box. Okay, well, it's pretty quiet out there in National Coalition Academy land. I guess that's what happens when we have a webinar and not a Zoom conference. So I'll be asking you all lots of questions when we're back on Zoom. Thank you, Amy Miller. Talking about meeting with community leaders. That's excellent. And also, Susan, great point about identifying those consequences that happen in the community. I mentioned earlier that it can be really difficult to talk about these things. But if we have these tragedies that are happening in our community, it's a great opportunity to help identify and move community readiness. I want to also roll out to you a couple reminders and some one very valuable resource. So just remember as you're moving forward that a community can't be convinced to approach an issue until it realizes that that issue exists. And so as a coalition, we want to make sure that you're helping your community recognize the impact that the issues that you're addressing have on the community. We can't force our communities to take action on these issues or go against what our members believe. And so being able to assess the community readiness is a really important place. Have a question in the question and answer box. The question is, what if your community is not helpless or empowered, but rather a bit apathetic about actually taking action? They want to help, but taking action is another issue. And I believe that many of our communities experience just this. Apathy is an issue that, I see so many communities having trouble with the apathetic feeling of so many of their members. And I also believe that sometimes we portray apathy because we don't feel like we can do something about a problem. The problem feels so big. And so I believe the coalition has a really important role here by coming in and introducing our theory of change, our model of change, and showing how it works. And so sometimes we can move that apathy to a place of empowerment by giving people the training that they need, by giving people the approach, and then also by evaluating our work and being transparent in showing these are the things the coalition did to contribute to the problem, and here's how collectively in our community things have changed and issues have shifted, And then I believe that it gives people the platform to see that something is working. And it's sometimes the ball has to get rolling and things have to be working before we're able to recruit people from moving from a place of apathy to being able to take action. Because most people don't want to take action on something if they don't think it's going to help. And so it's the responsibility of the coalition to be able to articulate to the community how the work that we do impacts those actions, impacts those issues, and then that in turn helps us to wrap that conversation back around to community readiness and move that to really get people onto this idea that we can do something about the issue. And Michelle asked a question, will you be sharing with us the community readiness model? And yes, I will. That is coming next. I tried to drop it in the chat box. Unfortunately, since we're in a webinar and not a meeting, it won't let me do that. However, this comes directly from the Tri-Ethnic Center for Prevention Research. The website is there on the screen. I'll go ahead and type that in the chat box for you as well. This is a wonderful resource. It's also free, which is great for everyone. But the cool thing about this Tri-Ethnic Center for Prevention Research is the Community Readiness Handbook. When you go to this website, you'll be able to download a PDF, and that PDF has everything that you need, including an initial sample set of questions that you can use with key informants, that you can use. Remember that you're working with a diverse set of constituents and stakeholders in your community. And so we want to make sure that we're measuring community readiness based on that broad set of the different communities within communities that exist within our target population. But if you download the PDF here at this website, it goes through the whole theory of community readiness. It shows the community readiness model with respect to the different stages of readiness, and then also the community toolbox at Kansas University also has some great resources on how to move from one stage of readiness on to the next, that many of which I have shared today. So those are both great tools for your coalitions to use. Again, there are so many different ways that you can engage in a community readiness assessment. What's important is that your coalition picks one and implements it. I want to also just make note, and I know you all hear this all the time, but if your coalition needs support in your development, if you want to get started with a community readiness assessment and you don't remember the resources or don't know how to start, then please make sure to reach out to CADCA, 1-800-54-CADCA extension 240, or training@cadca.org. This will hook you up with CADCA's Coalition Development Support Team that's headed by Dave Chevelle. And we'll make sure, and Dave and his team will make sure that you get the resources that you need so that you can get moving on a community readiness assessment. Also, I want to make note that Salma is on the call today, and Salma and her team can help you with all things National Coalition Academy. So if you need support in getting your next person registered for week 3, or if you need to speak with Salma or her team for any reason, you can reach them at 1-800-54-CADCA extension 221, or you can reach her by email, nca@cadca.org. And then finally, my contact information is on the screen. If you need any follow-up with me, I invite you to contact me anytime. Got to give a big shout out to my Key West and Lake Tahoe cohorts who are out there today, but also all the other National Coalition Academy participants who are here. Thank you for taking time out of your day to really think about community readiness. Selma has just posted in the chat box the evaluation link. And as y'all know, we really take your feedback to heart as we're planning next trainings for you. And so please help us to improve our training for you and give us some feedback there on that evaluation link. And also have some other trainers in the house. So hey to all our other trainers. Happy Monday, everybody. I hope your Monday goes excellent. Please make these last few minutes useful and fill out that evaluation link, and follow up with us if there's anything that we can do to support you as you embark in assessing community readiness in your community. And most importantly, I want to say thank you for what you do. What you do in your community is a valuable resource and is often something that goes unthanked. And so, thank you for what you do to make your community a better place. Keep up the good work, friends, and we'll talk to you soon.